Even though CUSP, the Comprehensive Unit-Based Safety Program, has program in its title, it's not necessarily just a program. It's really a way of being. It's a way of thinking, it's a way of acting, and it's a way of going about making change.
Our number one job as a psych tech is to ensure the safety of the patients and ourselves. We need to make sure that the unit is safe, the kids are being safe. On the second floor is typically little kids from ages like 5 all the way to 18.
Behavioral health care is centered around a milieu therapeutic environment, and a milieu is really the community by which we do our care. And so our patients are ambulatory, they're pediatric, they're children that are active and engaged, and it poses some challenges, and that's where our CUSP program really came in.
We had a really high rate of patient-to-patient assaults that were happening on our unit, and it was becoming an issue, a big issue. And so once we sat down with staff, we broke it down, and it was communication. Like, there wasn't enough communication going on for people to understand that we needed to, jump in and stop this before it was actually happening.
The frontline staff members really identified was that there was a gap in psychiatric technician to psych tech handoff. Now we're talking about relational challenges, that Johnny's not getting along with Mary, and or that there's this clique that's not getting along with this clique. And so those things weren't really highlighted in the medical record or the typical handoff in Cerner.
So we updated the 24-hour safety huddle, which goes out to everyone on the second floor, and then it also goes out to our house administrators and people who might come up and help on the unit, and it gives more information about kids that are struggling with certain things, boundaries that might be happening with kids. So if people are more likely to assault someone, we will see it in the 24-hour safety huddle now.
The staff taking an active role is, I think, a very important part of it. People who are with the kids, really the majority of the time, may have insights that people with different degrees of expertise may not have for particular kids.
It's really a game changer in the way that we've engaged the frontline staff members to really be the experts and to show us what they need to get their needs met for patients to remain safe in our care.
We believe in continuous performance initiatives and always trying to get better at the things that we do. CUSP is a very simple and elegant model.
It's not leadership coming in and telling us this is what we need to do and this is how we're going to do it. It's staff saying this is the issue and these are the steps that we are going to do to fix it.